I will be talking on neurodiversity in the classrooms and specifically, talking about how do we identify and support children with ASD. I just want to recheck again that I'm audible, Sikha, right?
Yes,
Use
yes,
the
you are
mic.
audible. Very nice.
Just
She's
one
better
sec.
with the mic, Priyanka. When you lose that, then the voice muffles off.
Okay, is this just one
Yeah,
sec?
this is better.
Yeah, all right, just one sec. I am not going to, not able to see the, just one sec.
You need to share your screen for that.
Yes, yes.
So I think you are a co-host, so you should be able to share the screen. Yes,
Yeah.
the screen is sharing now.
So was it visible earlier or it wasn't?
No, no.
All
Just
right.
now the screen has been shared and now we can see
All
the
right. Okay,
screen.
now it is seen, right?
Yes, it
Because that's
is.
what I felt that I didn't think I had shared it. Yeah. So see, we all are working with children and we have seen that in every class there are children.
Again, just sorry to interrupt. If you leave
Yes.
your mic now, then we will not be able to
All
hear you
right. All
properly.
right. Okay. So is this better? Am I audible?
Yes, this is
Yeah.
perfect.
So see, in every class, we see children who think, communicate, behave, and learn differently. And it is seen in many forms, and there are many diagnoses given as learning disorders, ADHD, autism spectrum disorders, sensory processing difficulties, developmental delays, cognitive difficulties, and so on. But when we talk in terms of neurodiversity, neurodiversity does not describe it as a disorder or disability or deficit, but it emphasizes the fact that every individual is unique. We all have different strengths, interests. We all have our set of skills and challenges. All our minds work differently, and our brains take in, process, and respond to information in different ways. So, this whole neurodiversity movement was actually started as a social justice movement in the 1990s to promote acceptance of individuals with differences. And this term neurodiversity was coined by the Australian sociologist Judy Singer to promote equality and inclusion of what we call as the neurological minorities. So let's understand some terms. When we say neurotypical, neurotypical refers to most people whose brains process information in a similar way. Neurodivergent are people who process information differently. And neurodiverse refers to a group of people. So when we say neurodivergent, it refers to an individual, whereas neurodiverse is a group of people representing multiple and different neurocognitive styles and differing in terms of their neurocognitive functioning. So when we talk of a classroom, we would say that a classroom is neurodiverse. So it is of utmost importance that we identify, recognize, respect, and support these differences. So, neurodiversity is not actually a medical term or a medical diagnosis, but it's an umbrella term used for many different conditions, as we described as autism, developmental language disorders, ADHD, developmental coordination disorders, learning disorders, tic disorders, and many more, even from the psychiatric domain. And each of this is a topic in itself for discussion. Today is the World Autism Awareness Day, 2nd of April. So I would be talking more about autism and neurodiversity and how to identify and support children with autism in the classrooms. So what is autism spectrum disorder? Autism is a neurodevelopmental condition and based on the diagnostic criteria by the DSM-5, the Diagnostic and Statistical Manual, the symptoms features are clustered into two subsets. Subset A, which has deficits in social communication and social interaction, and subset B include individuals who have restricted repetitive behavior patterns, interests, and sensory concerns. So it's a combination of all these features. So children and adults with autism may communicate, interact, behave, and learn in ways that are different than most people. And typically, the symptoms present in the early developmental period, autism can be reliably diagnosed by 2 or 3 years of age, but it is often not diagnosed until much later. And we will see also why does this happen. So, all these features that I talked about, let's understand them better by some scenarios that you would be seeing quite commonly, quite often in the classrooms to try and pick up features of autism in children that you see, and also some features which may look like autism but which may not be autism. So let's look at the different scenarios. So here we have a 3-year-old boy who is in nursery. He is a cheerful child, does all his activities, but speaks very few words. And his speech is not clear. The parents say कि बहुत तोतला बोलता है. And he does a lot of actions to communicate and he gets his things done. So everything is by just gestures and actions. He likes to play with other children. He can hear rhymes. He imitates, but sometimes he needs to be talked to loudly or he may need repeated instructions. So, what could be the cause here? This is a child who is speaking very, very few words, but is able to communicate, convey with a lot of actions, what we call as non-verbal communication. He's showing an interest in children, he's playing with other children, he's showing imitation skills. So, what we are seeing here is a child with isolated language delay and not really fitting into the autism spectrum. Here we have another boy who is 4 years old. He's in junior KG. He keeps saying letters, numbers, colors, rhymes. He actually says a lot of words. But he does not talk to or answer when he's spoken to. Or when teachers ask him some question, he does not respond to the question. But teachers understand that he knows because he may see a red ring and say, red. So he knows a lot of things, but he's saying it more in his self talk. And he often does not look into your eyes, tends to sit in a corner, does not engage in school activities, does not play or interact with other children, and cries with the loud sounds with school bells. School has raised concerns here, but parents think he's very smart and feel that he's just shy because he was mostly at home during COVID. So many teachers and school personnel do see this scenario also often, where the child is speaking a lot of words. Parents may be in denial and may not be in denial, it's just that they are not aware. And they feel, so many parents come and tell me, Madam, to 18 महिन्याला सगळे colors सगळे त्याला येत होतं. So they in fact feel very proud that my child knows so much. But they fail to understand that the child is speaking words but not really engaging in conversation and not really responding when you talk to the child. So this child is definitely showing features which are consistent with the diagnosis of autism. Let's look at this boy. He's 5-year-old. He's extremely hyperactive. He does not sit in one place. He's all over the room. Keeps pacing from one end to the other and keeps clapping his hands when he's excited. Throws all objects, toys, activity materials, crayons, colors, pencils are all on the floor, and he just does not engage in activities. And he is able to sit only if he has a car with him. He keeps moving it back and forth. And he's frequently sleeping, lying down on the floor with the vehicular toys. Teachers feel that he might be having ADHD, and rightly so, because he is so hyperactive and so all over the place. It is really very difficult to manage him. So here, what are the thoughts? The child is hyperactive, but also the child is throwing a lot of objects, activities which suggest ADHD, but the underlying social communication deficits are something which are not, picked up. The child is not engaging, the child is sitting in one corner, the child is showing some repetitive behavior patterns. So here we have a child who has autism with ADHD. And when we see children with autism, the activity level is very variable. So while there are some children who may be sitting very quietly in a corner, there are other children on the other end of the spectrum who may be very hyperactive, who may be all over the place. And in so many children, the hyperactivity component is so predominant that the underlying social communication deficits may be missed, or it may be overshadowed by the overtly hyperactive behavior that the child is showing. Let's look at this girl. She is 5.5 years old. This girl is completely silent in school. Teachers and other children have never heard her speak. She does not even talk in the carpool. So the parents do turns and 4, 5 children go in the carpool, and none of the parents have even heard her in the carpool. She avoids eye contact. She avoids interactions with people, but she completes her activities in school. She's fine with her grade level academics. Parents say that she's very talkative and chirpy at home with the family members, but as soon as she steps out of home, she goes into a shell and she does not speak. So, does this girl have autism? She is not speaking, she's avoiding eye contact, she's avoiding interactions. So, this girl does not have autism, but she has what we call as social anxiety, and a significant form of social anxiety is what we call as selective mutism. So, when a child is not talking in class, it could be due to various reasons. We could be seeing a child with just a language delay, and it is very important to rule out a hearing deficit in any child who is showing a language delay, because you cannot rule out a hearing deficit just by saying that the child is hearing sounds. Sounds are made of different frequencies, decibels, and so many times mild, moderate, to even more than moderate levels of hearing deficits are missed when we just go by the sounds that the child has heard, and we definitely need a formal hearing evaluation here. A child could have an isolated language delay, or the language delay could be part of the global delay. So whenever a child shows a delay in one aspect, we definitely need to see the fine motor skills, the gross motor skills, coordination. So it is very important to look at all the activities that the child is doing. Look at the coloring of the child, look at the fine motor activities, look at how the child is doing the puzzles and the colors and things like that. The language delay could also be a part of the autism spectrum. And as we said, in autism, one could have variable levels of activities, right from a child being very shy to a child being very hyperactive. And we could have variable levels of learning capability. So one child could be very bright, and there could be other child who could be having a lot of learning difficulties. And one should not miss out the child who is also remaining very quiet in school because of social anxieties. So going back to the slide where I had mentioned that symptoms present in the early developmental period and can be reliably diagnosed by 2 years of age, but often not diagnosed until much later. Now, why is this so? One, it is because of lack of awareness, that you are not really aware of the features of autism and you don't pick it up. But the other important factor is that symptoms may not become fully manifest until the social demands exceed the limited capacities of the child. So we could have a child who may have been able to cope with his social challenges in the primary years. But when the social demands increase, when the complexities of relationships increase in the secondary years, that's when the symptoms of autism may manifest. And also the features may be masked by learned strategies in later life. So let's look at some of these scenarios. Here we have a 13-year-old boy who is in the 8th grade, and he has received varied diagnosis. At the age of 3 years, he had a lot of sensory concerns. So he would have sensitivities to sand, grass. He would not like his shirts, the tags in the clothes, and he was diagnosed to have sensory processing difficulties. At 7 years of age, he had attention concerns, and somebody diagnosed him to have ADHD. This child is very good with numbers, sciences. Many call him gifted, and he has won math Olympiads. His reading fluency is fair, He struggles with abstract comprehension, reflections. He is going to an IB school. So they have a lot of reflections to do. They have to do inferential, critical thinking, source analysis. So he struggles with those areas of academics. He does not really enjoy sports, does not engage much into physical activities, but he has been excessively interested in dogs right from the time he was very little. He can speak well, but has difficulty holding conversations with peers, picking up social cues. He is very direct in his expressions and comments, to an extent that he does tend to sound rude. And he is not discreet in the comments that he makes. So he may tell somebody, hey, you're looking like a clown. And he would not think of, what the other person would think. And the child, he may be right, but he has no discretion of, what I can speak and what I should avoid speaking. And this is what is affecting his peer interactions. He gets upset with sudden changes in the routine, or if things don't go as planned, has difficulty with transitions, and is very rigid about his routines. So, what is a diagnosis here? He has received multiple different diagnoses in the past, but when we join the dots right from the challenges that he has been facing since childhood, here we realize that he also has features which are consistent with the diagnosis of autism, but they started manifesting only when the social demands increased beyond his capacities to cope with the demands. Let's look at this 10-year-old girl. Just one sec, I'll just change. Am I audible? I just want to recheck.
Yes, you're audible.
All right. So here we have a 10-year-old girl. Now, this girl tries to talk to peers, but she has difficulty making friends. So she really tries to, enter into a, group of girls. She has always been excessively interested in mermaids, unicorns. She has her own fantasy world and prefers talking mainly about them. So she has difficulty fitting in with her peer group because she wants to keep talking about her interests. And so she tends to get along with, some child who may be interested in mermaids, but again, those friendships don't last for long. Others tend to avoid her, they tend to ridicule her, and often she tends to get bullied. She feels very uncomfortable when she has to wear the formal school shirt. So she really tries to fit in, but she is unable to. So this girl is attempting to make friends. Does she have autism? Because we know that children with autism tend to stay aloof. They don't want to interact with other children, and this girl is trying to make friends. But this girl also has features from the autism spectrum. So when we see girls with autism, autism often is overlooked or goes undiagnosed in girls with autism because they may not always fit into the typical stereotypes. So girls with autism may have the typical girly interests. So a girl interested in mermaids is not unusual, isn't it? But typically these interests are quite intense and they could be very excessive. Girls also tend to do what we call as masking their natural behaviors, suppressing their natural behaviors, and pretending to fit in. And this leads, and that's the reason why they're more prone to anxiety, because they're always trying, pretending to fit in and trying to be what they are not. So there are increased incidents of anxiety, depression, bullying, which is seen in girls with autism. So when we look at the statistics, autism is 4 times more common in boys than girls. But when we see autism in girls, either it may be more severe, which we are not discussing here, or often it may go undiagnosed, especially in the high functioning girls with autism because of masking. So to sum up, children with autism have difficulties in the areas of social interaction and communication as well as behavior. But we can see that every child is so different, and the same challenges of social interaction and behavior can present so differently in different children. And hence it is very important, one, to pick up the early signs of autism, especially in a young child in the preschool or primary years, where we see an inconsistent eye contact, lack of responses when we call, language delays, and again the child not compensating for the language delays by using gestures, non-verbal communication. If you see any repetitive patterns in the behavior, movement, or the play patterns, if you see the child showing any sensitivities to the environment, because in preschool you would do sand play and you would do a lot of activities with slime and colors, and if you see a child who is not really wanting to touch the wet paint or slime, definitely you should look out for features of autism in the child. But it is also very important to keep a watch and look out for symptoms and features of autism which may show up later in the child when the social demands exceed the capacities. So, what are the possible causes and risk factors for developmental conditions, including ASD? So, one, children with ASD and in fact many other developmental conditions have a strong genetic predisposition, and we may also see family history of similar challenges. But it is not just one cause. It is what we call as a gene environment interplay. So there are many other causes, and when different causes get together, that's when we see a child manifesting with the features of autism. There are other risk factors, birth related factors during pregnancy, complications during birth, prematurity, a child not having cried after birth, postnatally, jaundice, meningitis, convulsions. All these could be risk factors for a child having autism. So, how prevalent are the developmental conditions? So, estimates in the US, as per the CDC statistics, suggest 1 in 6, or about 17% of children in the age group of 2 to 17 years have one or more developmental conditions. And these could be, as we discussed earlier, ADHD, learning disabilities, autism, intellectual disabilities, cerebral palsy, sensory impairments, hearing loss, vision impairments, and the other developmental delays. And this constitutes a whole spectrum of neurodivergence. And how prevalent is ASD? As per the latest CDC statistics, about 1 in 36 children has ASD, and the worldwide prevalence is estimated to be about 1%. So, what are the challenges faced by children with ASD in the classroom? As we saw from all these scenarios, children with ASD face social challenges. They may have cognitive and learning challenges. There may be many behavioral concerns that you may be seeing. There could be sensory challenges. There could be difficulties with executive functioning, what we call as organization, planning, time management. And again, we should not miss out children who may be masking their symptoms, who may be trying to suppress their natural behaviors, because all these are also anxiety provoking and may also lead to other mental health conditions. So how do we help these children? We need a multidisciplinary approach. It is not just one person, but we all are a team. As a developmental pediatrician, I'm involved with the diagnosis, planning interventions and therapies for the child, medical management for children who may need medications. Schools need to be very inclusive, supportive, provide accommodations, and we all have to be advocates for these children. We all have to help parents with parental education, training, and empowerment, because the more the parents are empowered and educated, the child will benefit, because 24/7 the child is with the parents. And we really need to spend a lot of time with the parental education. But the child is also spending a lot of hours in school. So, how do we support neurodivergent children in the classroom? So, as we have seen that every classroom is neurodiverse, even in a mainstream school. So we are not just looking at a special schooling setup. So we have seen that autism is a wide spectrum. So there are children who could have more severe concerns and who may need a special schooling setup. But there are many children who are in regular classrooms and who are going to mainstream schools. So we see that every classroom is neurodiverse with children having different challenges. So it is very important at a school level to create a very inclusive learning environment. So by inclusion, we don't just mean that, there has to be inclusion in the classroom and the school infrastructure, but inclusion should be the philosophy of the school, should be the belief and attitude of all the personnel involved in the school. And if we create an inclusive learning environment, it is not just going to benefit the child who is neurodivergent, but it is also likely, and it does benefit other children who may not have had a diagnosis, who may be facing certain challenges, or who may not, in fact, even fit into a diagnosis, but are just, struggling with certain areas. So inclusion is not something which is an add-on for just select kids, but inclusion is something which has to be ingrained in the school policies and in the school infrastructure. So, for example, when we see a child who is facing challenges with learning and attention concerns, we need to have a preferential seating for the child near the teacher, near where the teaching is going on, away from distractions, away from windows and doors. A child who is, movement seeking, it is very important to schedule regular movement breaks for a child who finds it hard to sit in one place for long. It is very important to use different teaching methodologies using audio visual aids, communication devices, and also children who may have specific learning needs. It is important to create a individualized education plan and have a specialist support within the school setup. Children with autism especially face a lot of struggle with the social difficulties. It's very important to identify a support person or a buddy for giving the social support to the child. So, in fact, for children with autism, it is not really the learning hours or the classroom hours which are difficult, but it is the time spent outside the classroom, the break times, which are in fact very unstructured. So, children with autism are, they like structure and they are better if there is a structure, but a break time is very unstructured. The child doesn't know what to do in the break time, and also there are many challenges during the break time. So social challenges, that child wants to play but doesn't know how to fit into a, enter a play situation. There may be, difficulties picking up social cues from other children, interacting with other children. So it is very important to have buddies for the children, to have lunch buddies, and to identify even other personnel like, some teachers, counselors, even sometimes a school nurse, because many children are very comfortable going to the nurse's room. So to identify a person who the child is comfortable with and who the child can go to whenever the child is feeling very anxious or overwhelmed or upset. So this is very important. The other set of challenges that children with autism frequently face are the sensory concerns. So, children could have sensitivities to loud sounds or certain textures, food textures, certain smells. So, again, break times could be very overwhelming because there is a lot of cacophony of sounds of, different children. Practice times when they are practicing for some performances, there is loud music going on, loud shouting going on, the child could really get very overwhelmed, what we call as sensory overload. And in fact, the child may start showing a lot of behaviors when the child is very overwhelmed. So it is also important to have sensory corners or quiet corners in the school, which the child knows and the child can go to just to unwind and just to get over that sensory overload and then get back to the learning class. And one could also make accommodations to the school uniform. So many schools have a formal uniform which, involves a shirt with collars and all, and they may also have the other t-shirt kind of uniforms with a soft fabric which the child could choose to wear if the child finds the other type of clothing uncomfortable. So it is very important to create these kind of sensory corners and strategies to help the child with the sensory difficulties. Now, behavioral concerns, this is where the teachers face the most challenges, because so many children with autism may have behavioral concerns in the classroom, and teachers really get very overwhelmed to manage those behaviors. And I understand it is very difficult, but if we understand some basic principles of behavioral management. It would help the teacher and the child. So what we'll end up seeing is just the behavior of the child. Here, what we need to understand is what is called as the ABC of behavioral analysis. So B is the behavior that we see, C is the consequence of what happens post the behavior. But to change the B and C, what is important is to change the A, what is called as the antecedent or the trigger. What has triggered that behavior? And the triggers could be quite different in different children, and they could be different in the same child at different times. So many times we see triggers which are because of sensory overload, as we described earlier. When the child is very overwhelmed, the child may just act up, and the child may have a meltdown because the child is just can't bear the sounds in the environment. Sometimes the triggers could be a sudden change in the routine. You were supposed to have this class and there was a sudden change, and now you're doing something else, because many children with autism have difficulties with transitions or sudden changes because they're rigid about their routine. So here, having visual schedules, putting up, children are good visual learners, so it is very important to put up the visual schedules in the classroom where the child knows what activity is following what. And even if there is a change, it is better to put a visual schedule so that the child is prepared for the change. And even if there is a sudden change, it is important to inform the child before the change. Sometimes the behaviors are triggered due to communication difficulties and the social interaction difficulties. So if the teacher is on a watch out of what triggered the behavior, one could anticipate the next time it happens and be more prepared as to how to manage those behaviors. And many children need help with the executive functions. What I talked earlier with the planning, organization, time management, submissions of projects. So it is very important to help them with planners, with calendars, with timers to organize their work and submit their work on time. So it is very important to understand whenever somebody says, oh, the child is not behaving, it is important to understand that the kid is not misbehaving, but just being, because a child is just being what he or she is. So it is very important to understand that rather than trying to fix the behaviors, it is important to make changes in the environment as well as our attitudes to manage those behaviors. So even a small change at our end can make a big difference for the child. So many teachers who may be there for the sessions today might also be wondering, because the teachers themselves are quite overwhelmed. There are some schools which may have a better child to teacher ratio, and one child is seeing 15-20 kids, but there are other schools where one teacher is seeing about 40-50 kids, and the teacher has to manage other kids. Some schools may have better resources, better infrastructure, but other schools may have limited resources and limited infrastructure. But if we understand some basic principles, and even if we make a small change at our end, by understanding these principles, it can really make a difference for the child. So in the words of Jim Sinclair, he was an autistic scholar. He says, grant me the dignity of meeting me on my own terms. My ways of being are not merely damaged version of yours. So it is very important to have the dignity of children who may be neurodivergent. And it is important to teach all students, teachers, admin, as well as support staff about neurodiversity. So one could, have these sessions on, say, the assembly times, or one could have awareness days like, today. One could have these sessions, talks for students, for the admin staff, for the support staff, to sensitize them about neurodiversity. And this way we can create a overall inclusive school ecosystem, which will go a long way to support children with neurodiversity. So to summarize, when we speak in context of neurodiversity, neurodivergence does not necessarily describe it as a disorder or deficit or disability. So again, here, we are not really taking away the medical diagnosis of the child. or the need for support and interventions by calling it a difference. So we are not trying to trivialize it. The child needs the support, that the child has a diagnosis. But what we are doing is taking away the deficit framing terminology and looking at it from the perspective of inclusion and acceptance. So neurodiversity is a different way of thinking, behaving, communicating, and learning. Neurodivergent individuals have their own individual strengths, which should be encouraged and nurtured. And not just the child, but all students would benefit from a greater awareness of neurodiversity and more inclusive environments. So it is very important to instill the qualities of kindness, empathy, equity, as well as equality and inclusion for all children. Thank you.
Thank you, Dr. Priyanka. Thank you so much for such a lucrative talk and discussion on children who may be neurodivergent or who may be autistic or who may be different in their behavior in classroom. It would not only help for managing these children, but also to set up a supportive classroom for these children.
Yes.
Yeah. So if there are any questions from anyone, it's most welcome. You can ask or you can put it in the chat box as well. Yeah. So Mrs.
Hello.
Geeta, yeah.
Can I speak? Can I say?
Yes, madam. Please.
No, ma'am, in my I work in inclusive school. There's a one child autism, but he knows everything. He can write, he can read everything. Well, IQ is very nice, but he doesn't want to read and write in classroom. What can I do?
Yes.
He knows, but if he see the copy books, he don't want to touch only. But at home, he used to write near mother, but in school he doesn't want to write. But he knows everything.
Yes. So see again, as we have discussed that, many children with autism could, have a very, in fact, they may have cognitive abilities even above average, or as we, saw in that example, but they may not be able to, respond when you are asking him to do something. And also, it is also very important when you talked about the writing part, it is also very important to look at the fine motor skills, because there are many children who can read well, but who may be having fine motor difficulties, and when it comes to writing, which is also fine motor skill, they may avoid writing. What is
But
also
his fine motor
important
is okay.
yes,
He
and
can write well. At home,
yes,
he's write nicely.
yes, but what is also important is what we call as written expression. So many times, even when we are looking at the learning skills, the child's reading may be good, the child may be orally be able to say well, which of course a child is doing at home, but the child may be having difficulty with the written expression, that when the same thing the child has to frame, what we say organization of writing, the child is really not able to frame and organize his written expression, which is also a part of learning difficulties. What is also important when children are reading well, especially children with autism, is also to look at comprehension. Many times they may be very good readers, they may be advanced readers, they may be good with sciences and math, but as we again discussed, they may find the abstract kind of comprehensions difficult, where you have to think, you have to infer, you have to conclude, and many children tend to take things very literally. So understanding phrases, idioms, they just take the meaning as a literal meaning. So it may be difficult for many children to take the implied meaning. Many times what we say, reading between lines. So what is the implied meaning? What does a child, what does the author actually intend to say? So these are areas which could be difficult for the child. And again, when we say the child is writing at home, we also really need to see the quality of work that the child is doing at home, because parents still may say that ha mera bachcha likh raha hai, but it is also important to review what exactly the child has written and the quality of his written expression. So there are many aspects that we need to look at. And the child may just not be wanting to cooperate to write at that time. So many times it may be, that you have different ways of assessing the child. A child may not be really ready or cooperate for the typical examination ways of assessing. So the child could have more of an ongoing assessment when the child is again not in a pressure situation or an exam situation to be assessed, because during that situation the child may not perform. So it is very important to see what is the ongoing work of the child.
Dr. Priyanka, we have a question on the chat box as well. So if somebody is asking that if you see a child who is 2.5 years old in the classroom having symptoms of autism and relay it to the parents, how is screening done for them at this age, and how it is certain for sure that they could be on the spectrum?
Yeah, so see, as we have discussed earlier, autism can be reliably diagnosed at 2. Sometimes, if all the symptoms are present, even less than 2, at 2.5, if the child is, establishing all the criteria, one can also diagnose a child with
Mike,
autism.
please, Mike.
Yeah. So one could also, diagnose a child with autism at 2.5. So screening is what we use the MCHAT. That is, typically done at 18 months, but one could reliably diagnose autism at 2, 2.5, even 3. But as we said that what is important is that if we have picked up red flags and if the child is not yet showing all the features of autism, we still need to start with the intervention. So it is not that we have to wait for the child to be diagnosed. So if we are seeing some inconsistencies in eye contact and we are seeing speech delays, we are seeing interaction difficulties, it is very important to start with the interventions. So many times we may wait also to give a definitive diagnosis, but we do not wait to start with the interventions until we diagnose.
Okay, thank you. So another question is that
Ma'am, I have
about
a
on
question.
selective mutism. So please put on the chat box if there is a question. We can take the chat box questions. So it's on selective mutism. So there is a
Yes.
child who speaks at home but doesn't speak in the school. The mother says he speaks at home. So they want to
Yes.
know whether it can be selective mutism.
Yes, yes, the child definitely should be assessed for selective. Again, it's a range. Some children may just have a social anxiety. They are able to speak a little, but children who just don't speak also receive a diagnosis of selective mutism. And here, children not speaking due to selective mutism, rather than speech therapy, one would need more of behavioral therapy, counseling to work on the social anxieties. So, yes, these scenarios are there, but also look out for other features. So we definitely need to do a overall complete developmental assessment to see the behavior patterns, to see the sensory aspects. And when everything else is ruled out, we know that, okay, this child is, fitting into the diagnosis of selective mutism. Sometimes you may even ask for videos of the child at, interacting at home. So the child is completely quiet in school. And when the parents say, then we ask that, okay, get the videos and to see how the child is interacting at home. That also gives us an idea. And we do see amazing interaction at home in many children with, social anxieties and selective mutism.
So basically, they need a proper screening. That's what is
Yes, yes.
important
And
and
also
guidance.
counseling and behavior therapy
Yeah.
rather than, the speech therapy, because a child is, of course, we have to see the language skills. Is it, appropriate for age? But here the child would be needing more of the counseling and the behavior therapy.
Okay. Any comment on gluten-free diet in autism?
Yes. So again, there are, various recommendations for autism, and what we need to see is the evidence base of the recommendation. So the gluten-free diet, or what we call as a GFCF diet, the gluten-free, casein-free diet, does not have a evidence-based recommendation to be recommended for all children with autism. There have been smaller studies, some case reports where they have shown some benefit of the GFCF diet for children, but it is, as per today's evidence, not recommended for all. If there are parents, of course, parents may ask for a, so many parents have done a lot of reading over the internet. So it is very important to, if a parent does want to try out a GFCF diet, it is very important to at least first check for a gluten sensitivity, to rule out, if there is a gluten sensitivity, then definitely one would go for a gluten free diet. If there is no gluten sensitivity, then discuss the evidence base with the parents and then give them a choice if they want to go for a GFCF diet. But what typically also happens, what I have seen is that they just reduce the amount of wheat. And, in a birthday party, there is some cake has been given or some biscuits have been given here and there. So again, when we are doing a gluten GFCF diet in children who may have a gluten sensitivity, it has to be a complete elimination of the gluten. And it is not something that you can give off and on or once in a while. And you definitely need
Okay,
to meet
so
a nutritionist to then, see what other alternatives can be given so that the nutrition doesn't suffer.
just to abbreviation to full form, the GFCF somebody's asking, it's gluten-free, casein-free
Gluten-free,
diet.
casein-free diet.
Casein-free diet. So one very relevant question someone has asked, that if such a child who is on a spectrum has a meltdown in the class, so how do the teachers handle that?
Yes. So see, again, when we are looking at meltdowns, it is important, as we discussed, to identify the triggers. But when the child is actually having the meltdown, of course, then we go back and see what triggered it. But during an actual meltdown, it is very important to, as we said, to have a sensory corner for the child, to have the child, have some quiet time to unwind, to get off the sensory overload, and then relook at the situation as to what caused that meltdown. So unless we are really looking and analyzing what triggered that meltdown, next time it happens, it would be difficult for the parent, for the teacher to manage.
Okay, so somebody is asking, is a
It
shadow
is
teacher
very
necessary?
important to acknowledge what the child is going through. Sometimes we are just saying that, oh, this child is behaving in the class. But it is very important to acknowledge that, yes, I understand that you are very upset. I understand that you're very angry. So it is also very important to acknowledge the emotions of the child and not disregard it. And then try to work around what best we could do to help the child.
Okay, thank you, ma'am. Another thing is, Mrs. Nandini is asking, is a shadow teacher always necessary for an autistic children when he is in school?
No, not always necessary. Again, it is always a debate many times between the schools and the parents. So one has to see the level of support that the child needs in a classroom. So many children, as as we are seeing, are going to regular mainstream school. It depends on the class strength. It depends on the child to teacher ratio, and it depends on the challenges that the child is facing. So all these factors will, decide whether there is a need for shadow teacher. There are many children who may need a shadow teacher to help, mediate that gap between, because, a child may take a instruction better one-on-one, but may be very lost in a group setting. So it is very important to, understand the need for the child, and then over a period of time to also try and see how we can, get the child be more independent, because we also don't want the child to be dependent on the shadow teacher, and try to have the child develop the skills for more independent work. So many times when the shadow teachers are also going to the school, they could also step back to see in which situations the child is able to manage things on his own and step in where the child is needing that help. So the shadow teachers are also not somebody who has to always be with the child, but also help to child gain more independence in the school setting.
Okay, so Mrs. Asmita wants to ask that sometimes when autistic children are brilliant in certain aspects of reading and writing as well, but there are certain areas when they are not. So how to convince the parents? Because when teacher tries to tell the parent, it is difficult.
So talking about the diagnosis of autism.
Yes.
Yes.
So that the child has a problem. Can the teachers tell, or how? If so, how?
So see, the teachers can't talk about a diagnosis, because the diagnosis has to be made by a professional. So the teachers could definitely, put it in a way that, see, here we are seeing that the child is, and always talk about the positives first, that we see that your child is very good with the academics, but we also see that the child is, facing difficulties, has social challenges. So why don't you just get the child evaluated to see if we could help the child in these areas? So if we put it in a way which, the parents are more receptive and always refer them to the professional developmental pediatrician, whoever can diagnose a child. And it is, of course, a process. There are some parents who are very receptive to the diagnosis. There are, many parents who are in denial and who may not be really very accepting of the diagnosis. So it is also a process for us, and putting it in a way that, the parent over a period of time is, accepting of the diagnosis. So sometimes it is a journey for the parent too, to be able to come to terms and to be accepting of the diagnosis.
Okay. Another question, Dr. Priyanka, is if certain children in preschool age group, they are either hyperactive or developmental delays, or as a counselor, they suggest that they can have movement breaks. But similar is expected by the normal children as well then. So if 3 to 4 students out of 30 have these problems, what are the recommendations to deal the others as well, to give
Yes.
them that extra breaks?
Yes. So, see, what could be done is, I understand, especially in a preschool setting, when one child is getting a, but what could be done is, to involve the child with, with the classroom activities, and maybe also give some turns to other children. So again, the child does not seem to be singled out. And for example, giving out the worksheets or distributing the crayons and things like that. So one could have, turns for the children, maybe lesser turns for the other children, and, more. And the movement breaks could also not be similar kind of breaks all the time. So as we said, that this has to be ingrained, and it is not something which you do only for a select few children. In a preschool setup, anyways, there are, many activities that we do which involve movement. And one could then, identify children and, get it done in a way where other children are not feeling left out. They are also included as a part of those, movement breaks, but to a lesser degree or a lesser extent.
Okay. Since we still have some time, somebody has asked, though you covered it in your talk, that some few points on how to handle or interventions for toddlers with autism in a classroom. So if you can brief one or two things for the
Uh,
audience.
yeah. So, are we looking at interventions in the classroom, right?
Yes.
Interventions in the classroom for toddlers. Yeah. So, see, again, see, the toddler age group is what we say as, the 3-4 year, the
Just
preschool
a second.
age group.
Please mute yourself. Others, please mute. Sudeshna Guha, Miss Sudeshna Guha, please mute. Nehal ma'am, if you are the co-host, I think you can mute her. Yeah, she has muted herself.
Yes. So again, when we are talking for, strategies for toddlers, we have to, follow similar, sequences, or, similar, groups of challenges that we see. So one is to identify.
Just a second, Dr. Priyanka.
Yes, yes, yes.
Vinod, you are there. Please mute Miss Sudeshna Guha. Vinod, please mute. Yeah, done. Yes, Dr. Priyanka. So sorry. Please go on.
Yeah, no worries. So, see, what we need to identify is that what are the challenges that we are facing, with the toddler in that classroom. That is one that we need to see. And we have, identified the cluster of challenges. So we are not really even looking at a diagnosis, but we are looking at, is the child, having sensory challenges? Is the child having communication challenges? Is a child having behavioral challenges? So one is that you identify the cluster of challenges that the child is facing, and then formulate a plan accordingly. Typically in a younger age group, what we see is that the children may have, delays in different, aspects of their development, typically the communication. So many of the toddlers have not even yet learned to speak. So compared to the older children who may be able to do, speak more sentences, a toddler might not be even speaking, or might be speaking very few words. So what is important is also to try and establish communication where we are using a lot of actions, gestures. So many times just a verbal communication with a child, a verbal instruction may not work. So when you are saying that, okay, come on, open your drawing books and pick up this crayon, or give me this, a verbal instruction may not work. We have to supplement the verbal instruction along with gestures, be more animated with the child. We need to come down to the level of the child, because children have difficulties making eye contact. The teacher is standing, the child is sitting. It is very important to sit at the level of the child and give instructions one on one, looking into the eye, and keep the instructions small and simple for the child. So
Okay.
if the child is facing difficulty with sequential instructions, you just give one instruction at a time, because teachers are used to also giving multiple 2 3 things at one go. Remove your bag and remove this and then put it here. So a child may not be able to process the sequential instructions. So it is very important to break down. It is very important to establish the eye contact and then give the instruction. Use a lot of gestures, point out to a lot of things, see that the child is responding to our pointing, and then go on further. If the teacher feels that the child is just naming letters, numbers, it is very important not to keep just encouraging that, because here it is repetitive. The child is just saying colors, letters, and it is important, rather than focusing on the academic vocabulary, to focus more on the conversational vocabulary. So these are all the aspects that we need to look at. If the teacher sees that the child is sitting and lying on the floor doing some repetitive behaviors, it is very important to also keep breaking those behaviors even in the classroom setup. Because if a child is excessively interested in cars, in preschool there are lots of toys around, and the child may just pick up a car, sit in a corner. So it is very important to be vigilant. And it may be easy because the child is manageable, child is not running around, child is not disturbing the class, so वो वहाँ पे वो कार से खेल रहा है. But it is very important to break those patterns, because the more we allow those patterns to continue, it will become a more established pattern.
Okay, so I think we have just one or two questions more we can take. One important thing is these kids may have a habit of biting. So is there any way that that can be handled?
Yes. So again, we do see biting behaviors quite frequently, and these are more due to also what we call as oromotor sensory difficulty. So it is like a oromotor sensory seeking behaviors. So when we talk of the sensory concerns in children with autism, sometimes they show hypersensitivities, that they may not like certain textures, the fabrics or sand or grass, or even textures of food. And some children may show a seeking behavior, that they want that texture more and more. So mouthing objects, mouthing toys, biting people. So this is something which is a more of a sensory seeking behavior. So one is that we have to meet a speech therapist who, along with the language therapy, also does what we call as oromotor therapy, where there are exercises, where there are special brushes, where they also give some chewy tubes to help with the oromotor sensory seeking concerns. And if a lot of these concerns are happening with school, the parent could also send those chewy tubes and all to the school, so that the child is able to work on those oromotor sensory concerns even in the school setting. Many times the biting may happen because of difficulty in communication, that the child got angry, upset, or the child wanted to communicate something, but the child has language delays and the child just lands up biting. So it is also very important to understand what led to that biting. So again, looking at the triggers. So we need to look at all the aspects holistically.
Yeah, so we'll take one last question. But before that question, there are certain questions on the chat box which cannot be discussed on this forum. And if the child is already diagnosed with certain things and is on follow-up with a doctor, please discuss the details with your doctors. This is not a forum where we can recommend Ayurvedic medications or something like that, or whether the child will be okay or not. You really need to discuss with your doctor. So some parents have put questions on that. We'll take one last question, which I feel is very important: how to sensitize the classmates regarding the autistic children. So is there any way where, because these are also very young children, of preschool or just nursery first standard children. So how can they be sensitized that this children has a problem,
Yes.
this child
So
has a problem?
again, see, where sensitizing the classmates is also a process. So again, the language that we use, the words that we use are, also different with, with the maturity of the children as they grow into the, higher grades. So with a young group of children in the preschool setting, we would not be using the word autism because, they don't have the understanding to understand the implications of the diagnosis. So again, when we talk of neurodiversity, it is not just autism, but we say that we all are different, and it is talking in a language that we all have our strengths and we all have our challenges. So we are all good at something and we may find something difficult, and we can always give examples that look, this child A is so good at drawing, but it doesn't come first in the races and things like that. Again, we don't want to really use the word first and second, but is not able to run that fast. But see, this one is able to do this, and he's not doing this as well as this child. So we all are good at something. We all have aspects that we find difficult, and okay, this child finds it difficult to make friends, so let us help this child to make friends. Let us go ourselves and try and be the friend of the child. So this is how we can put in a language that the children are able to understand. Not just talking about it, but one could also make stories and tell the children, especially in a preschool setting. So one could use ways where we are using stories to communicate, because sometimes just telling directly one on one may not really sink into the child, but when it is told in the form of a story, children understand better. When it is done in the form of a play, so when you're doing some play where there are characters, you're doing puppets. So we need to use a lot of playway manners, playway methods to help children understand certain concepts. And as they grow older, then one can start using some words and some terminologies. And again, use these, days, awareness days, assemblies to talk about these differences.
Okay, so thank you, Dr. Priyanka. Very nice discussion, and we could cover a lot of questions as well. And so, what I gather is if we include everyone, everyone wins. So, these are children who should not be excluded from the classroom, rather included in the classroom in a structured, in a predictable
Thank
manner.
you.
So, I
Thank you.
also thank the teachers and the counselors and the parents who have joined in for the session. And the team IIT Mumbai is really thankful to all for joining and having a very interactive discussion. Nehal ma'am, would you like
Thank
to
you
say
very
something?
much.
Yeah, no, I think thank you. It's really wonderful to listen to Priyanka. Every time there is something new that we get to learn. And of course, today's was more regarding the classrooms and the neurodiversities. But Priyanka, I'm sure this is going to help us also as pediatricians in a great way. I mean, so many soft points brought out. And thank you very much for accepting our offer and coming over on this platform with so many teachers and counselors here, who I'm sure everybody in the chat box has been putting that they're extremely happy for the talk and benefited with that help. So one thing that I wanted to share was there are a lot of people who are putting up messages that whether the YouTube link will be available, because there were certain technical glitches. Some came in initially in the past and then again joined. Definitely generate one, Dr. Priyanka, and she will be putting up in all those that Priyanka you can do. So I think everybody can
Yes.
have an access to get the entire recorded version once.
Yes, sure. I'll
And
definitely
yes,
send
thank you once again.
Thank you very much for the invitation and this opportunity to interact with all of you. It is a topic so passionate to me, and I'm always, always ready and happy to share whatever I can from my experience to, help all of us help our children.
Thank you so much. Thank you so much, Dr.
Thank
Priyanka.
you. Thank you.
Thank you very much,
Thank
everyone.
you. Thank you.
Thank you so
Thank you, ma'am.
Thank you.
Thank you, ma'am.